Well, good morning and welcome to the City of Toronto's COVID-19 media briefing for Friday, January the 28th, 2022. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and COVID-19 Incident Commander Matthew Pegg. Mayor Tory?
Well, good morning and thank you, Brad. As we get ready for the provincial reopening on Monday, I want to thank everyone who stepped forward to get their third dose to help combat the Omicron surge and every member of Team Toronto who has helped us to ramp up these vaccinations. Team Toronto has delivered more than 1.3 million third doses, and this has helped to ensure that 57% of eligible residents have the best protection possible against Omicron. Work to vaccinate residents in all corners of the city continues because, of course, 57% is not as high as we want to get this. We want to keep pushing it up, and we're going to continue to work at this. I want to give a special shout-out to a vaccination initiative being undertaken by a great Team Toronto member in Scarborough this weekend. This Saturday and Sunday, the Scarborough Health Network will be hosting their Family Roll Call Vax Weekend, and this is in order to boost vaccination numbers in Scarborough and to continue the work to make in-class learning as safe as possible. The details on that have 9 a.m. to 7 p.m. on Saturday and Sunday. Families can come to one of the 3 clinics that they've set up in Scarborough to get their first, second, or third dose. These clinics will be open to anyone and everyone and are located at the Centennial College Progress Campus Athletic Wellness Centre, the Centennial College Student Centre Ashton B Campus, and the University of Toronto Scarborough Campus Highland Hall. Residents can book their appointment at scarbvaccine.ca or walk in. Anyone that needs a ride, you can call Scarborough Ride at 416-736-9372 or visit scarbvaccine.ca for more information. They have a goal of vaccinating 5,000 residents, which is just fantastic, and so I hope we can help them to make sure that they achieve that goal, because that will help us to continue to push those numbers up. So if you need your first or your second or your third dose, please head to one of those clinics this weekend. This will help to protect you and your family and your community and your co-workers and your fellow students. And I want to thank the Scarborough Health Network for continuing the work that they've done. They've been such great partners all the way through to help people get vaccinated. Our city's VaxTO team is sending out 8,770 broadcast voice messages this morning to help build awareness of the Scarborough Health Network initiative for this weekend. And it's another great example of teamwork where we can all work together to push those numbers up and keep people safe and healthy. I'm very pleased as part of the progress we've made, in part because we've been getting vaccinated, to announce that this coming Monday, as part of the province-wide reopening, the city will be resuming a number of services and reopening many of our own facilities, since the provincial regulations will now allow us to do so. Although the city has worked very hard to provide options like skating and skiing and snow loops for residents to get outside for exercise and for their mental health, it is great to know that we will soon have more options for people to stay active. The city will be reopening community recreation facilities for drop-in programs and rentals starting on Monday. Residents across the city will be able to reconnect to their communities through safe exercise and social activities. This is especially important, as we know, for young people and for seniors who often have fewer options available to them and who look to the city to provide them with those safe spaces where they can be active and engaged. It should be noted that starting Monday, we will still be subject to provincial capacity restrictions, with some programs and facilities limited to 50% capacity. The facilities reopening on Monday include community recreation centres, fitness centres, weight rooms and walking tracks, arenas, indoor pools, enhanced youth spaces and lounges, and older adult centres. And within these important community spaces, the city will be resuming the following programs, subject to some restrictions: fitness classes, lane and leisure swims, aquafit, indoor leisure skate, arts, general interest and sports drop-in programs, and bookings for arenas and gyms and meeting and event spaces. Proof of vaccination will continue to be required for those aged 12 and older entering indoor sports and recreational facilities. Enhanced vaccine certificates, those with the QR code, are the only acceptable form of proof of vaccination for admission to those facilities. Required online reservations for lane, swim and aquafit are available today. Those online opportunities are open right now. Allen Gardens Park and Centennial Park Conservatories will be opening to the public, also effective on Monday. Animal attractions at Riverdale Farm and High Park Zoo continue to be accessible to the public with capacity limits in place. We're all very excited to getting back to using our community spaces. This is a good step forward and part of the cautious optimism Dr. de Villa has spoken about, which I share, and it's part of why we continue to have our determination and resolve to keep getting people vaccinated so that we can keep moving forward in this manner. It does remain important to keep safe and continue to follow public health advice as we continue to move forward, because if we work together on this, we can continue to reopen and increase capacity on more and more city facilities and community spaces and programs. And so that makes it continue to be the case that it is of the utmost importance for people to get vaccinated and to make sure that those around them, loved ones, neighbors, co-workers and friends, can be comforted and reassured such that they too can get vaccinated. There are appointments available today for first, second, or third doses. The city-run clinics continue to have appointments for residents, but starting this Sunday, they will also be available for walk-in administration of vaccinations. These walk-in appointments are open to both adults and to kids. As we move ahead with reopening, we are also working to make sure that Toronto comes back stronger as we put the pandemic behind us. I am determined to make sure that the city and its economy come back stronger than ever. It will be an increasing focus of mine as we make progress on the health side, and I will be engaging other governments, business, labor, and nonprofits in a major effort to get our city back on a strong economic footing, which is exactly where we were before the pandemic started. That strong comeback will rely on Toronto having the continued COVID-19 support the city needs from the federal and provincial governments. We have worked with the provincial and federal governments throughout the pandemic to make sure that Toronto and all municipalities have financial support to protect frontline services, many which were ramped up to respond to COVID-19, and at the same time to make sure that things like transit systems and other areas hit hard by the pandemic could keep running despite dramatically reduced ridership. The federal and provincial governments provided more than $2.8 billion to Toronto in 2020 and 2021 to help protect services, to allow us to move forward with crucial capital projects and all the jobs that they support, and to help preserve things like TTC service. I have on many occasions expressed my gratitude to Prime Minister Trudeau and Premier Ford for their understanding of the limits on municipal finances and on the need for strong, healthy cities, and I reiterate that gratitude again today. The city did its part at the same time over that 2-year period by finding more than $1.1 billion in savings, efficiencies, and offsets over 2 years, almost $500 million more dollars again this year. But the pandemic has continued longer than any of us might have expected, and this year our 2022 budget includes a $1.4 billion COVID impact, meaning money that we are short of, most of it, a good deal of it, coming from revenue losses at the TTC due to continued lower ridership. I have talked to both governments about this issue over the past few months. I know they are committed to working with the City of Toronto. The federal government, for example, renewed their commitment to continued support for municipalities during the last election. The provincial government spoke to this commitment most recently in their fall economic statement. Earlier this week, I thanked Ontario Finance Minister Peter Bethlenfalvy and Deputy Prime Minister Freeland for continuing discussions on municipal operating budget shortfalls, which I know they were doing as recently as last week. I did so based on the accounts I did receive from representatives of both governments that they had constructive discussions on this matter as recently as last week's federal-provincial finance ministers' meeting. This assistance is critical for us to have confirmed in order to protect essential frontline services and capital projects that create jobs and will help the Toronto and national economies recover and be strong. That is made crystal clear in a briefing note that is being considered by the Budget Committee today, and I would draw your attention to that note. All of this starts with the understanding that cities cannot raise or borrow money in the same manner as the other governments. We are not allowed to run a deficit, and I'm fine with that. But then, when we need help, when a pandemic devastates our transit ridership, for example, and the revenues disappear that went with that ridership, then that is the principal reason we're in the position we're in, and we are looking for continued partnership with the other governments. In the briefing note, Our city staff warn that if COVID-19 funding from other governments is not forthcoming in such a way as to allow us to fully address the financial impacts arising from the pandemic, the city would have to, first, cancel $300 million in planned capital projects in 2022. This would be spread across a variety of capital budgets, but would have an impact on TTC work, transportation services, parks, forestry and recreation state of good repair projects. Second, the city would have to pause more than $1 billion in capital funding that would go to state of good repair projects. This would have a devastating impact on the work that we are doing to invest in infrastructure, to invest in a state of good repair. Many of these things that have been postponed for years and that are much needed to have a healthy and growing city. And it would also have a very definite impact on jobs. Thousands of jobs which would be impacted by any decision to cancel or postpone these projects. As the budget briefing note outlines, an increase in public infrastructure spending on things like non-residential building construction, engineering construction, capital outlays on machinery and equipment, these investments generate a mid-range estimate of roughly 9 jobs for every $1 million of expenditure. So the 2022 one-time reduction in capital expenditures and funding intended for capital infrastructure, if we had to impose that kind of reduction, would therefore have a serious impact on job growth, with $1.4 billion in reduced capital impacting potentially 12,600 jobs, negatively impacting the Toronto, Ontario, and Canada economies, all 3 of those economies. They're all, of course, interlinked. That is why support delivered in a timely manner is so important to our city and to its economic future and to its ability to move forward and lead the way when it comes to a strong recovery for Toronto, but also for all of Canada. These are consequences I have shared with the other governments in a series of discussions on this matter over some period of time. I wanted to highlight this report today so it is clear to everyone why this discussion is important and why we need to come to a resolution together as soon as possible. I remain absolutely committed, as I have been throughout this pandemic, to working with Prime Minister Trudeau and with Premier Ford to move our city, our province, and our country forward, because Toronto has the capacity as the country's economic engine to move all 3 forward, the city itself, the province, and the country, and to ensure that our economy, our residents, and our businesses all do in fact come back stronger than ever. We have proven that we can work together, and we will prove it again. We all know that investment in strong, healthy cities, and that's cities right across the province and the country, but my responsibility is to the people of the City of Toronto. Investment in strong, healthy cities, including the country's biggest city and its economic engine, will pay those investments back many times over, and quickly at that. And that is why this is such an important matter for us to get addressed and concluded as soon as we can. I would now ask Dr. de Villa to offer her report for today.
Thank you, Mayor Tory, and good morning. While Omicron continues to spread in the community, we are seeing signs that cases may have peaked and have started to decline, and that the individual and collective efforts Toronto residents have made to lessen the impact of COVID-19 are paying off. Although provincial testing capacity remains limited, and the true number of COVID-19 cases is higher than what is reflected in reports, we have seen a decrease in the 7-day moving average of COVID-19 cases in Toronto, from 1,414 cases on January the 19th to 871 cases on January 25th. The percent positivity of COVID-19 tests has also decreased week over week, from 20.3% to 16.6% as of the end of last week. In the absence of widespread COVID-19 testing, Toronto Public Health continues to monitor COVID-19 activity in the community using a number of different data sources. For example, the number of active outbreaks in institutions and in congregate settings has declined overall, which is a positive indication of a decline of COVID-19 in the community. Wastewater surveillance, or testing Toronto sewage for the presence of COVID-19, looks at changes over time helping us understand the presence of COVID-19 in the community, regardless of the testing strategy that's in place. Beginning today, Toronto Public Health is making wastewater surveillance data to the public, available to the public, as part of its regular COVID-19 surveillance reporting. Ontario's wastewater surveillance is coordinated and hosted by the Ministry of the Environment, Conservation and Parks. Ryerson University and the University of Toronto complete laboratory analyses on wastewater samples collected by the City of Toronto. The wastewater surveillance data on the City of Toronto website are analyzed at the provincial level through this ministry, who then summarizes the data from the 4 wastewater treatment plants in the City of Toronto. Toronto Public Health will update the wastewater surveillance report on Wednesdays moving forward. The latest analysis shows that the declines noted in the wastewater signal across most of Toronto's wastewater treatment plants over the last few weeks are now showing some signs of slowing or plateauing. However, taken all together, there are certainly encouraging signs. And while they give reason for optimism, we must remain cautious, especially as in-person interactions will increase following the loosening of provincial restrictions on January 31st. We continue to see a large number of people being admitted to hospital and intensive care on a daily basis, and our healthcare system's capacity is still stretched thin. Currently, there are 575 Toronto residents in hospital with COVID-19 and 93 people in ICU. You have also likely heard recent reports of a new Omicron subvariant called BA.2. At this time, we have limited information about BA.2 and how it may differ from the Omicron variant that is the current dominant variant circulating in our communities. For now, it is sensible to remain cautious. Given these developments and in anticipation of increased in-person interaction following the removal of certain provincial restrictions on January 31st, it remains critical that we all continue to do our part to minimize the spread and impact of COVID-19 by taking the steps that have been proven to work time and again. This includes getting vaccinated, reducing our contacts, wearing a well-fitted, high-quality medical mask, practicing physical distancing, increasing ventilation, and staying home when we are sick. While these measures slow the spread and impact of COVID-19, Omicron is highly contagious. And as more and more Torontonians encounter Omicron, we expect that immune protection from COVID-19 will rise in the community as a result of prior infection. This is expected to occur because the body's immune response to COVID-19 infection will provide some protective effect against future infection. However, the amount of protection this provides varies from person to person. This also comes at the risk of experiencing serious health impacts and potential long-term side effects from a COVID-19 infection. This protection gained through infection may also wane over time or be less effective at preventing reinfection by different variants of the virus. The COVID-19 vaccines offer a much more consistent immune response and, as a result, more reliable protection against COVID-19. I strongly recommend that all eligible individuals get vaccinated and boosted against COVID-19, including those who have recovered from a COVID-19 infection. As I shared earlier this week, Team Toronto is focusing its efforts on a hyper-local, mobile, and pop-up clinic strategy that brings the COVID-19 vaccine to people where they live, work, study, and play. Thanks to an ample supply of both Pfizer and Moderna vaccines and the amazing efforts of the Toronto Public Health staff and our Team Toronto partners, there are many vaccination opportunities available for eligible Torontonians in the coming days and weeks. Each dose delivered represents another step towards blunting the impact of COVID-19 and gives me hope that we will soon move on from this challenging time. I know that this has not been easy, and I remain ever grateful for the many Torontonians who have stepped up again and again to do their part. Thanks to your efforts, we will get through this together. I'll now hand it over to Chief Pegg to deliver his remarks for today.
Thank you, Dr. de Villa, and good morning. I'm pleased to report that we are continuing to see a favorable trend across our emergency services with respect to unplanned absences as a result of COVID-19. Yesterday, our emergency and essential services operated with an average unplanned absence rate of 6.9%. This is down from 10% just a week ago. This is testament to the effectiveness of the unplanned absence mitigation strategies that each of our city services have been implementing since the outset of the Omicron wave of COVID-19. Between December 24th and January 27th, our emergency and essential services operated with an average unplanned absence rate of 11.5%. Yesterday, Toronto Paramedic Services operated with 120 ambulances on the road and an unplanned absence rate of 6.4%. Also yesterday, Toronto Fire Services operated with all 124 frontline trucks and crews in service and an unplanned absence rate of 3.3%. I would like to once again acknowledge and thank each and every member of our team who continues to report for duty each day, accept extended and overtime shifts as required, and for going above and beyond to ensure the continued delivery of the services that our residents rely on each day. From a citywide perspective, yesterday, we operated with an average unplanned absence rate of 4.6% across all of the city divisions. This is down from 6.7% just a week ago. Each of our other emergency, essential, and critical services, including Toronto Police, Toronto Water, TTC, Shelter Support and Housing, Senior Services and Long-Term Care, Children's Services, and our city-operated COVID-19 vaccine clinics also continue to provide exceptional service to Toronto residents, and I thank them also. Finally, our COVID-19 Strategic Command Team continues to work every day in order to ensure that all aspects of our citywide response to the pandemic remain both responsive and effective. As the situation with COVID-19 continues to evolve, we continue to evolve our planning and response accordingly. As always, I encourage you to continue to make toronto.ca/COVID-19 your first choice for up-to-date, accurate, and timely information on all aspects of COVID-19 response in Toronto. Thank you.
Thank you, Chief. We'll now go to questions. First up, David Ryder from the Toronto Star. Go ahead, Dave.
Good morning, everyone. Question for Dr. de Villa. Yesterday, Dr. Moore talked about reducing contact tracing to very specific situations and also not requiring restaurants and bars to collect information that would help with contact tracing by local health units. Can you tell me sort of your reaction to that, and what is the situation right now with contact tracing in Toronto? What do we do, and is that going to change?
So sure, David, thanks for the question. And I think this really all stems from the change in the provincial testing regime. Because, you know, if you don't have contacts unless you've actually got a confirmed case. and those cases are determined based on testing. So at this point in time, given that testing is focused on those highest risk individuals and on highest risk settings, that's where the case and contact management efforts are being focused. These are the settings where we know that people who are most likely to have severe outcomes associated with COVID-19 infection, and where we know ongoing transmission of COVID-19 is most dangerous and most likely to have a significant impact on health. That's where the resources are actually being focused on at this point in time. Of course, as part of public health efforts at this point in the pandemic, you've heard us speak about this for many weeks now, and you'll continue to hear us speak about it for some time yet. We're focusing our efforts on all the preventive strategies to stop cases from happening in the first place. So vaccination is key amongst those prevention strategies, but of course we can't forget those self-protection measures you've heard me speak about so many times over the last couple of years now. Wearing the mask, physical distancing, ventilation, keeping your distance, and of course staying home when you're sick. So those are the focuses of public health at this point in time, given our current circumstances.
Thank you. And following up on that, Dr. Moore also talked about, it sounded like kind of a change in the way of looking at COVID, and saying that we're going to have to get used to living with the virus, and that, he talked about possibly, raising or lifting restrictions going forward. It sounded like, in a significant way. What do you think for Toronto about learning to live with the virus as opposed to combating it? And are we ready to lift many or all restrictions in the next couple of months?
So I think that, the rate at which we lift restrictions, and of course these are under provincial jurisdiction, will rest, one, with the province as it's their area, and second, will depend on what we're actually seeing on the ground. So certainly the monitoring that happens is going to be crucial and an important part of that. But I think increasingly over time, perhaps at the beginning of the pandemic, now a couple of years ago, there was some thought about, eliminating COVID and going for a COVID zero strategy. And I think the reality is now that increasingly public health officials the world over are recognizing that given the current circumstances and given the presence of variants like Omicron and the significant transmissibility that they bring with them, that really we are likely to have to find ourselves in a situation where we are learning how to live with COVID. People are talking about, eventually getting to a point where COVID is more endemic. It's part and parcel of our background. You may see some flare-ups over time, but I do think that this is increasingly where public health officials are understanding we're going to need to go over time. What exactly that looks like will depend on what we see on the ground, but I think that it will involve using all those lessons we've learned over the last 2 years. We know about the benefits of vaccine, and we're incredibly lucky to have these safe and effective vaccines in our toolbox. But we also have a number of other public health protective measures that we can use to good effect. So at this point in time, it is absolutely thinking about how we learn to live with this virus and how we continue to use the tools we have at our disposal in order for us to protect ourselves appropriately from COVID-19 and its negative impacts, but as well to restore much of what we have missed by way of activity and services and all those other aspects of life that have frankly been more challenging over the last couple of years.
All right, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead.
Good morning. A message for Mayor Tory to start, and getting back to snow removal issues in the city. At this point, obviously, we've been told of the effort and the progress that's been made over the last 11 days since that snowstorm took place, and you've been very supportive. But I'm curious, how concerned are you about city operations not being better prepared for something like this in advance, and what more can you do to make sure this doesn't happen again?
Well, I've begun by asking for a report to be submitted in the next month or two by our operations people on exactly that question. How did we respond to one of the biggest, say, 5 storms in the history of the city ever? 55 centimeters of snow in a very short period of time. And I think that report will, reveal some things that might have been done better, as these reports always do. But I will say that if you look at the magnitude of the challenge that was put in front of the team, which is historic in proportion, the biggest snow removal operation in the history of the city, without exception, I think they've been doing very well at that, and work continues. There are places and people who are frustrated. I understand that. They've done things in a priority order that I think was very important to do, with a big focus on safety. But there's always lessons to be learned from these things. And so we'll learn those lessons and we will do better. But I do want to say that I think the effort that's been put forward by the women and men who do this work for us has been good in extraordinarily challenging circumstances. 50,000, I think, or 60,000 tons of snow that have been moved. And we're finding our way with respect to some of the new areas where we're plowing sidewalks and so on with some of the new equipment. And that is the first year that we've been doing that. And we're going to continue with those efforts and, do better just by gaining experience. But I can just tell you that they're focused on, in the short term, on getting it done. The work continues over the next few days. I speak with them every morning and see the heat maps that indicate where some of the problems are, and we will get those problems resolved.
To your point that the work continues, I don't know what you've been told about next week, but there's another storm on its way with potential for 20 centimeters of snow on top of what we already have. What is being done now to better handle another possible storm like this just 4 or 5 days from now on top of what already has happened?
With a smile on my face this morning, I referred to that as a light dusting, 20 centimeters of snow, and normally that would be a major snowfall in the city of Toronto. And maybe that puts in perspective the fact that the one we had 10 days ago was 55 centimeters. And so this one, all the preparations are always in place for a 10 to 20 centimeter snowfall, and all the different protocols that talk about when plows start, where they start, when the salting and so on start, which is even before the snow gets here. And that will all be done, notwithstanding that the work will be continuing over the next few days to clear up from this historic snowfall, the largest snow removal operation in the city's history. But they assure me this morning they will be ready. This is more of a snowfall that would come in the ordinary course, even though it's large by comparison to what we get most days in the winter, and they'll be ready to deal with that.
I'm just going to ask Barbara Gray, our GM of Transportation Services, to add to that. Barbara?
Yeah, thank you very much. And I would just add that the importance of doing snow removal, as the mayor indicated, at the scale that we're doing it, is so critical for us to be able to respond to what we would consider to be a significant but normal amount of snowfall. So the work to do the removal continues. I think it is the most important thing, and we appreciate everybody's patience as we continue to work through that.
Thank you, Barbara. We'll go next to Chris Glover from the CBC. Chris, go ahead, please.
Oh, hey there. I just wanted to build off that first question a bit more. Or the second question that was around learning to live with COVID and what exactly does that mean? I understand perhaps from kind of a public health perspective from your cases, you kind of know what those outcomes might look like. But for a lot of people in the public who might be hearing that phrase this week and wondering what that actually is going to end up looking like or what the possibilities of that looking like might be, I understand that you're saying you need to wait to see what the situation is like on the ground, and monitoring is going to be important. But for those of us who are kind of scratching our head, trying to wrap our heads around what it actually means to live with COVID and what that could look like, could you give us a scenario or two of how you see this playing out in the next weeks ahead?
Sure, Chris. Let me see what I can and try to offer, recognizing that we are dealing with a novel coronavirus. Remember, that was what it was originally called when it first emerged on the scene. Now over 2 years ago. So I think there is much that we have yet to understand, and we've been evolving our understanding over the course of the last 2 years. But learning to live with COVID perhaps can be seen as akin to something along the lines of how we manage influenza on a yearly basis. And I just offer that as an example. It may not be exactly like that, but it might be something that I think people can relate to. So every season, every winter, we have cold and flu season. And some flu seasons are worse than others. And we know that it has impact on our healthcare system. And yes, it does make a number of people sick, unfortunately. And yes, unfortunately, people do lose their lives to it. However, we have treatments available, we have vaccines available to help protect us, and we find ways of balancing other activities of life along with the control measures that are there in place to better mitigate the negative impacts associated with influenza. So it's something along those lines. It may not be exactly like that, but I think that gives you and hopefully the public a little bit of a sense as to what living with COVID might look like, at least in part.
Yeah, thank you so much. It really does. And I was kind of thinking that was along the lines of what you were thinking. The curious thing that I guess I'm wondering is Dr. Moore made that statement yesterday. It came on the same time when we're seeing this convoy moving across the country. And I was at one of those protests yesterday. And a lot of folks in that crowd were saying things along the lines of what he had said yesterday, that we need to learn how to live with this. We can't be afraid of this. And they were seemingly placing themselves at odds with public health officials. So I'm curious, do you feel like the messaging is adjusting to kind of match that acknowledgement of the fact that public health is trying to say that they see what these people's concerns are? They understand that we do need to kind of live with this going forward. I guess what I'm asking is, was a statement like that yesterday and the statement that you just gave me there, is that kind of in reaction to the protests that we're seeing swell across the country?
You know, Chris, I think what I'm offering to you as a statement around what it looks like to live with COVID is actually a reflection of the science, right? And the best available science in respect of how to manage what has been a very significant public health challenge. In fact, the most significant public health challenge of the last 100 years. And I think it also reflects the general perspective of public health, which is that we are about promoting and protecting health overall. Right now, for the last couple of years, COVID-19 has been a very significant component of that. But we recognize, and we've always recognized, that the experience of health and the maintenance of health is about more than any single dimension. So as much as COVID-19 has occupied our minds for the last 2 years, we've always known that health is about more than just COVID-19. And we have now tools available for us. We've got safe and effective vaccines. We have protective measures that we've been able to deploy and use. And I see how well we've been able to do that. Here in the city of Toronto, more than 90% of the entire city has at least one dose of vaccine on board. And when I go out and look around, I see people really practicing, good public health measures, good self-protection measures, wearing their masks, keeping their distance, using ventilation, staying home when they're sick. These are the kinds of things that I think will help us get to beyond the COVID-19 pandemic, help us mitigate the negative impact of COVID-19, and ultimately help us get to address all the other aspects of life that actually contribute to our health as well.
All right, thank you very much, Doctor, and thank you all for joining us. That concludes today's briefing. Please stay well and enjoy the weekend.